Well, good afternoon. This past weekend, I went to help an incredible grassroots program run by the Canadian Italian Heritage Foundation called Pasta It Forward. They're delivering over 500 hot meals a day to seniors, frontline healthcare workers, and those in need all around the 905. So if you can help, please visit their GoFundMe page. They're entirely run by volunteers. My friends, we're all in this together. We can only get through these difficult times if we have each other's backs, if we look out for each other. Until a vaccine is found, the best way to protect those over the age of 70 and those with complex medical conditions is to ask them to self-isolate at home, as our Chief Medical Officer of Health has advised. It's absolutely critical. But I want our seniors to know that while we're doing your part at home, we are doing everything in our power to ensure you continue to have access to the necessities you need. We've been working with businesses and community organizations to make it easier for our seniors to self-isolate. That's why today we're partnering with the Ontario Community Support Association. We're investing $11 million to help the Meals on Wheels program and other community organizations. That's $11 million to help deliver food, medicine, and other essentials to our seniors and those with disabilities. I want to thank Minister Cho for his leadership on this important initiative. No one must be left behind. We have to take care of our own, and if you're listening right now, and if you're in a position to help, please reach out to your elderly neighbors or to anyone you know who might be in need. Offer to drop off groceries, deliver a meal, pick up the phone. It's the small things that make the difference. It's the small acts of kindness that shine brightest during these dark days. And we know many low-income seniors are facing hard times. My message to you today is, help is here. This week, the Guaranteed Annual Income System, or GAINS payment, are being delivered. And I'm proud to say we have doubled those payments for 194,000 low-income seniors across the province. This means up to an extra $166 per month in the pockets of our low-income seniors, and up to an extra $332 per month per couple. This will provide much-needed financial support to the seniors who need it most, and make it easier for them to stay safe and healthy at home. Today, we're also taking decisive action to protect our most vulnerable in developmental services, child welfare, and victims' shelters. We're providing $40 million to help these community organizations with COVID-19 related costs, such as purchasing masks and gloves to protect those in their care and our frontline heroes. My friends, we will not let our guard down, not for a moment. As long as we stand united, as long as we stand together, we will conquer COVID-19 and we'll get through this crisis. Thank you, and God bless the people of Ontario. Now I'll invite Minister Smith up to say a few words.
Thanks, Premier, and good afternoon. I want to begin by thanking the people of Ontario for their hard work, their compassion, and generosity as we tackle the challenges faced as a result of COVID-19. As part of our government's decisive action to contain the spread of COVID-19, we provided $148 million to local service managers and Indigenous program administrators across Ontario to give them flexibility to expand the key services they already offer to meet their local needs. We've also invested $40 million to support organizations who provide residential services for children and youth and adults with developmental disabilities. The uncertainty during this time has been particularly trying for our province's most vulnerable people. A little over a week ago, we saw an outbreak at Participation House, a developmental services home in Markham. We saw how quickly this virus can spread through a home and how important it is to ensure every step is taken to protect our most vulnerable and for those who care for them every day. I want to express my condolences to families who've lost loved ones to this terrible virus. We've all seen the stories, and they are truly heartbreaking. Many of these residents are beginning to recover after a very difficult week, and we're hoping those who are in hospital will make a speedy recovery and be back in their home as quickly as possible. I want to take this opportunity to give a special shout out to Dr. Jane Philpott, who I've talked to a number of times over the last couple of weeks. She stepped in when and where she was needed most. Thank you, Dr. Philpott. Markham Stouffville Hospital was able to step in per an agreement with the local health integration network as well to provide direct community service support to Participation House. This measure was instrumental in allowing critical staff to be accessible and allow for patients to be given the care that they needed. We're thankful to everyone involved in making this happen. We know there are immediate pressures facing our residential settings, and we're here today to tell you that we are taking further action. In the coming days, I'll have an update about the work our government is doing to create a plan to support our most vulnerable, including immediate actions that will have a direct impact. We're focused on prevention, enhanced screening, infection control measures. At the same time, we're looking at how we can address staffing challenges we know our facilities are facing on a daily basis. I want to thank our staff on the front lines, from our developmental services workers to our social assistance caseworkers and those supporting those in residential care settings. Thank you so much for the work you're doing. You're all working tirelessly to make sure those that you serve, continue to get the support and the care that they need. It's up to all of us to do what we can to prevent the spread of COVID-19, flatten that curve, and protect people in our communities. Thank you.
Okay, we'll go to the phone line. First question.
First question comes from Travis Danrash from Global News. Please go ahead.
Hi there, good afternoon. I have two questions for Minister Smith this afternoon. Minister, families of children with autism say that until today they have not heard from you during this crisis. Since all programs have been halted, will families be given an extension on the one-time autism funding that they've been provided? And what is the current status for families on the wait list for services?
I can tell you that my staff have been diligently working at making sure we're continuing to create that new needs-based Ontario autism program. To answer your direct question, we will be extending those who have childhood budgets for 6 months. That will allow them to get the services that they need, either during or after the pandemic is over. We've also taken steps to ensure that where possible, and we've been encouraging all of our providers, both on the public side and in the private sector, to move as much as they can onto virtual platforms or telehealth type programs, so that those individuals, those families can access the services that they need. We know how routine is so important for families with children with autism, and really their world has been turned upside down. We're doing what we can to provide those extensions to those programs, and where possible, making sure that they can get those services virtually.
And my next question is related to Participation House. We know directly from the Mayor of Markham and from families in group homes like Participation House that on only some shifts do they have adequate staffing and not enough PPEs, despite the Premier saying last week that if a home needs PPE, they will get them. Now, the Mayor of Markham is compelled to currently run a PPE drive for face shields. I want to ask you specifically, and I'm looking for a specific answer here, why have the PPEs promised not been delivered to this home, and when will the home be fully staffed every shift, every day?
Well, I want to thank Mayor Scarpitti for his advocacy, and certainly he's been a great partner, and I've been in contact with him a few times over the last week and a half, too, since this outbreak started. I want to thank the staff who have shown up to work there. I mean, this was an unprecedented time. Keep in mind this outbreak occurred as we were in the middle of the Easter weekend. It was extremely difficult to make sure that we had the staffing where it should be. Working with Markham Stouffville Hospital, as I mentioned, and the local LHIN and other public health agencies, we have been able, and the Ministry of Health, of course, to ensure that we have staffing there. I've been in daily contact with the Executive Director and the administrative team at Participation House since the outbreak occurred. They're very, very comfortable now in the staffing that they have. When it comes to PPE, really what I was told in the very early stages was they had a lot of masks. They had what they needed, but like a lot of different organizations out there, they need gowns, and the gowns have been hard to come by. I know that all of these organizations, if they need help, all they have to do is put their hand up to their regional manager at MCCSS, and working with our folks at the Ministry of Health as well, we'll get the PPE to those developmental services homes when they need it.
Next question.
Next question comes from Cynthia Melican from City TV. Please go ahead.
Hi, Minister. I'm going to pick up where Travis left off. When it comes to the autism community, I'm hearing from parent after parent that they feel abandoned by you and that you've been largely invisible. We know, as you mentioned, that they need a routine. Many parents have had to, I'm hearing, call police for help with their children or take them to ER. What can you do further for these families who are in absolute crisis?
There's a lot of families in crisis out there, Cynthia, and thank you for the question. You know, obviously COVID-19 is a very, very difficult time for all families, but particularly for families that have special needs children, not just those with autism. As I've mentioned, we have changed a number of programs to allow for services to be delivered online in a virtual type setting. I think that's very important. Obviously, not ideal given the current situation, but very little is ideal during this current situation. I feel for those families that have had their world turn upside down, but there are many families that are having difficult times. You know, we've given Minister Lecce, through Minister Lecce, we have delivered extra funding for families with special needs children as well, up to $250 a month to help them with some of the costs associated. And you know, it's just a difficult time for everyone. We're trying to do as much as we can to ensure that that service delivery will continue in some form or another, either through telehealth or through a virtual platform.
Okay, thank you. And my next question is for Premier Ford. Hello, Premier. Yesterday, you made a statement that got a lot of attention and praise from many, in that you took full responsibility for everything that happens during the pandemic, including what is happening in long-term care homes.
Yes.
What exactly are you taking responsibility for in long-term care right now, and what's gone wrong? And what specifically will you change going forward, even when this pandemic is over?
Well, we've had this conversation. Actually, I had it as early as this morning with the Minister of Long-Term Care. There's changes throughout the whole system, not just long-term care. I think through our healthcare system, through our procurement programs. But at the end of the day, one person has to be held accountable, and I'm the person that's going to be held accountable no matter which way this goes. And so far, I give all the credit. It's not me. I give the credit to the people of Ontario, the 14.5 million people out there that have been able to move the needle per se and get slightly positive results on the modeling. But there's always improvement. I've said this from the day I got in government. It's about continuous improvement and constantly looking to make the system better to serve the people of Ontario. So there's a tremendous amount of areas we have to look at and improve on all aspects. It's not just one area. If there's ever a time to see where the cracks in the system, this is the time that the cracks are showing up. And it's our job as government to make sure we fix it, but making sure we work collaboratively with municipalities and other stakeholders within the certain ministries.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi there. Good afternoon, Premier.
Hi, Colin.
So just looking ahead to businesses reopening when this entire thing is over, the Ontario Chamber of Commerce is saying that the government is going to need to spend and implement more measures to help small businesses survive post-pandemic. So your government is right now spending $6 billion in tax deferrals for 5 months, but those businesses are eventually going to have to pay back that money. The Chamber is warning that some business owners could simply close rather than having to keep drowning in debt when they have to pay all that back. Is the government willing to forego that tax revenue entirely if a business simply cannot pay it once they are allowed to reopen?
Well, that's something I'll sit down and talk to the finance ministry about, but we're doing everything we can with the $6 billion of deferrals Plus, we're working on a program right now with the federal government for rent leases, let's say, and there's over 1.2 million leases in Ontario. We're going to be working with companies to alleviate some of the pressure that they're feeling on leases. And then when we start up, we're going to support these companies. We're going to light a fire under the economy and get things moving again. I understand running a small business, Colin, it's tough, and there's so many companies out there hurting right now, but we're going to be there to support them and get them back on their feet.
Thank you. And just to follow up, so can you give us a sense of how the province is going to be there for them? What other measures are you going to be able to implement, or are you looking at any other measures beyond what has already been announced to help those businesses once the pandemic is over? And just, do you also think that the 400,000 jobs that we've lost so far, the province has lost so far, do you think all of those jobs will be able to be restored, or is the province going to inevitably lose a chunk of those jobs permanently due to the pandemic?
Well, I hope we aren't going to lose it. I just want to remind everyone, when we took office, we had lost 300,000 manufacturing jobs, and before this pandemic started, we were up 307,000 new jobs, and I was asking the Prime Minister, we needed 250,000 more people in the province to fill the jobs. I'm very, very confident with the support of industries and sectors throughout this province and working on our framework that's going to be released over the next few days, we're going to have the economy moving forward and going on all cylinders. It's not going to happen overnight. The whole world is seeing this. But if there's one area, one jurisdiction in the world I have confidence in, is in the people of Ontario. They're the most resilient people I've ever met. The ingenuity is amazing, and the work ethic is amazing. They're itching to get back to work, and once we get things going in full flight, we're going to have this province booming once again.
Next question.
Next question comes from Kayla Williams from CP24. Please go ahead.
Hi, good afternoon, Premier. My question is about OPSEU. They put out a statement yesterday in regards to the conditions at the Ontario Correctional Institute, saying that since the beginning of the COVID-19 pandemic started, it has pretty much been business as usual, and that some staff concerns were ignored. Why did the government allow the situation to get this bad to the point where they had to force to close the prison down?
Well, up in Brampton, a few people were infected, and we've transferred those over to the Etobicoke Correctional Services site by the South Lakeshore. I personally had someone drop off PPE equipment weeks ago. We've been in constant contact with the ministry there. Minister Jones has done an incredible job, as far as I'm concerned, making sure that we take care of the frontline folks that are prison guards, I should say prison officers, I apologize. And we're going to do everything we can to protect them. Absolutely everything. And last time I checked, and I'm just speaking for one location at Etobicoke, they were fully stocked on PPE.
Okay, thank you. And my second question is in regards to the economy, with millions being handed out in relief by the Prime Minister each day. Are you at this point considering easing some restrictions in order to get the Ontario economy started? Similar to what's happening in British Columbia, they have golf courses open where you can still continue physical distancing, and it appears that there are petitions being started now here in Ontario to start to ease the restrictions. Is that something that is on your radar?
First of all, before I answer that, I got to apologize as correctional service officers. I apologize to those folks. So I've talked to Premier Horgan. Keep in mind, they're about 3 weeks ahead of us. And when I spoke to him, it was about 4 or 5 days ago, they only had 9 cases in all of BC that day. So, you know, he's much further ahead of us on this COVID, based on they ended up getting the spike a lot earlier than we did. So once we get to that point, there's no one out there that wants to move forward on the economy more than I do. But we'd rather be safe than sorry. People are going to have to hang in there. I'm getting lobbied hard by so many different groups and organizations, but it's easy to say open, open, open until we get a second wave of this, and it bites us in the backside. I just beg people to be patient, and I understand we're dealing with 2 different worlds. right now. And the two different worlds are we're dealing with the impact that we see at long-term care, and then we see things getting a little better in the public domain. And I understand we're dealing with two different worlds. We're dealing with big urban centers like Toronto and Ottawa and other areas versus rural areas that are saying, why not us? I understand that, but I just ask people, just please be patient for a little bit longer. We're going to roll out the framework. We want to make sure people have hope, they have certainty. But once we get rolling, we're going to move forward quickly, and we all pray this doesn't come back and bite us in September. But we're going to move cautiously moving forward. But we'll get it going, and once we get it going, we're going to be firing on all cylinders. I'm very confident on our economy.
Next question.
Next question comes from Siobhan Morris from News Talk 1010. Please go ahead.
Hi, Premier. You talked yesterday about this framework to get things going again, and can you give us a sense of what businesses or services you're looking at to reopen in the first wave, whenever that may be?
Well, certain areas, and we'll be rolling this out over the next few days, but certain areas that you don't have to worry about working side by side on a line that you can't practice social distancing. Maybe outdoor activities we can look at. But again, that will be rolled out over the next few days. And we're going to be consulting again with municipalities and sectors, and to make sure that when the time comes, they get back to work, that they practice social distancing, and making sure that in some cases that they have proper PPE items for the people going back to work.
Can you give any specific workplaces, though, at all?
I really can't right now. I'd rather just wait a few days to make sure we cross the T's, dot the I's on this framework, and we'll be rolling that out over the next little while. But again, I'm getting endless calls about opening up. On a side note, I even got a call from Rob's son, 12 years old, my brother's son, saying, Uncle Doug, am I going to camp or not? And I told him, I can't answer that. Well, how about in August? I said, I can't answer that. He goes, well, find out and get back to me right away. And I thought, really? I'm getting lobbied by my 12-year-old nephew, too, about camp. So, but that's important to people. There's so many young kids out there, thousands of kids, that their biggest highlight of the summer was going to camp. And it weighs on their minds. And we're going to do everything we can. But number one is making sure we protect the health of the people of Ontario. And that's my number one priority. I just want to make sure this is done properly.
Last question.
Last question comes from Robert Bensby from the Toronto Star. Please go ahead.
Thank you, Premier. I wanted to ask you in the same vein as what Siobhan was asking you. Are there certain benchmarks that you are going to be looking at? You mentioned those yesterday. So we would see, say, you go 14 days without any new cases, or you go 14 days and no increase in cases. It's not even a 5% increase, just a 0% flatlining. Is that one of the benchmarks that you'll be looking at before you reopen the economy?
Well, the benchmarks I'll be taking off the Chief Medical Officer and the health team, Robert. But we will be setting these certain benchmarks before we can open up. And keep in mind, I want to emphasize this, even when we open up, that we start opening the tap up in a trickle. Sadly and unfortunately, people will still be dying. We still have deaths happening every day, and everyone's opening. They want to open up, and I'm thinking, really? We're seeing tremendous death toll every single day. That's the first thing I ask in the morning. How many people pass? It hits you hard in the heart, believe me. And every day you're hearing these numbers, and how many families are affected. I can't even comprehend all these families. Every day you see 30, 40, 50 people passing away. It's heart-wrenching. And even when we open the economy up a little bit, it's going to continue, but hopefully we can slow this down, slow the spread. But that weighs on you, believe me. You're trying to do a balancing act, but you can't forget about the people that have lost their lives over this terrible, terrible virus.
Yeah, I appreciate that, sir. Is there a sense that you think when we are not through this, but through this, when we're heading toward the next phase of openness, that maybe people will have to wear masks on the streets, and that's something that we'll just have to get used to if you want to go, or if you want to go into a store, not just a grocery store, but if other stores are allowed to open, you'll have to wear a mask. You might have to wear a mask if you're in an office tower, an elevator, things like that. Is that something that you foresee as part of that gradual reopening of the economy?
Well, I see people doing it naturally right now, and I don't see people really moving away from that. Again, we are going to need manufacturing done here in Ontario, which we're pushing companies to open up, because there's two things that have just been really, really tough are the N95s, the KN95 masks, and the surgical masks. So the quicker we can get companies to start manufacturing full flight here, you know, it's going to be tough to supply everyone in Ontario. But I guess that's up to the companies too. A lot of companies have been very generous, no matter if it's Magna or Bell or any of these companies donating hundreds of thousands of N95 masks. They have to take care of their people as well, and it all depends on you know, your job, how closely you're working with others. But I think a lot of people will be making their homemade masks as well that they can wear. People are going to be nervous for some time until we get a vaccine, and I don't blame them.
Thank you.
Okay, thank you, everyone. Thank you.